Hello, my name is Sandra. I'm the audiologist. How can I help you today? What did you come in for?
Well, I was referred because I'm having a hard time hearing my grandchildren and my friends
Mm-hmm.
during our weekly lunch dates.
Okay.
Now we go to this restaurant called Perkins, and it's really, really obnoxious. And when they talk, I have to have them repeat themselves, and I don't like doing that.
Okay. So let me go ahead and get your first and last name.
My name is Janae. My last name is Doe.
Okay, Miss Doe, I'm going to ask you a series of questions before we get started. And as we go along, I may have to ask you to elaborate more. Okay.
Okay.
First, you mentioned that when was your last hearing exam?
I have not had one.
And then how long have you noticed a decline in your hearing?
I'm not really sure. I just started to notice it about a month ago.
Okay. And then have you ever worn hearing devices like hearing aids or TV ears or anything like that? Any kind of devices?
No.
Okay. And then when you're talking on the telephone, which ear do you prefer to talk with, the right or the left?
I think both. I don't think I have a preference. I'm not really sure.
Would you say you've experienced a sudden or progressive hearing loss in the last 90 days?
No.
Have you ever had any ear surgeries?
Hold on. I have to think about that one. No, I have never had any ear surgeries.
Have you experienced any pain or discomfort in your ears?
I don't have any pain. No.
Have you ever had chronic ear infections?
No.
Okay. No wax issues?
No what issues?
Wax issues?
No.
Earwax? Okay. What about head trauma?
Yeah, when I was in my mid-20s, I got in a car accident. My head hit the windshield. But I'm pretty sure that I just got a concussion, and that's like all that I remember from it.
Do you happen to know where the area was? It was just like front or side?
I think it was the front, but I don't remember.
And then have you ever experienced any kind of like pressure in your ears?
Yeah, I get like some pressure in my ears, but it's not bad.
When do you notice that pressure occurring?
Like every couple days, like sometimes I wake up and like there's a lot of pressure in my ears, but I usually like either ignore it or like it kind of goes away.
And then do you happen to have any seasonal allergies or anything?
No.
Okay. What about, have you ever experienced dizziness before? Like, you felt like the room was spinning, like you were in one spot, the room was.
So sometimes when I stand up, I like stand up too fast and I kind of get imbalanced. And generally I feel a little unsteady on my feet and usually have to hold on to something while I'm walking to keep myself from falling over.
Mm-hmm.
But other than that, no, that's it.
Okay. Have you ever experienced tinnitus before? Do you know what tinnitus is?
No, what is that?
So it kind of depends on person to person, but a lot of people say ringing in the ears, whether it's high pitched or low pitched. Some people say crickets and stuff like that.
Interesting. I mean, I get like a kind of like humming sound in my ears, but it's been there for a long time. I don't even think about it.
You would say it's not bothersome?
No.
And then when do you notice it's occurring?
All the time.
Okay. And then do you happen to have anyone in your family that has had hearing loss?
Yeah, so both of my parents and my older sister have hearing loss, but I'm pretty sure it's from age.
Have your parents and sister, did they work in like industrial type settings where there was a lot of noise or what?
I actually don't remember where they worked, and I don't know where my sister works.
And then, do you have a history of any of the following? I can just jot them off to you. Cancer,
Yeah, I had breast cancer.
and along with that, did you take any kind of like platinum drugs, medications?
I can't remember what they gave me, but it was like 5 years ago I was treated, and now it's fine, I guess.
What about kidney issues?
No.
Diabetes,
No.
pacemaker,
No.
high blood pressure?
I do have high blood pressure.
Okay. What about frequent headaches?
I don't think I have frequent headaches, no.
Okay. And then have you ever been exposed to any of the following situations, like in the workplace, like lots of like noise exposure, like military, firearms,
No.
concerts?
I was a stay-at-home mom.
Okay.
I didn't go out very much.
And then how would you say your dexterity is? Do you experience arthritis or do you have any issues with that?
No, I'm fine.
Okay. And then how would you say your vision is?
Good.
Good. Okay. And then you mentioned that you have difficulty in like background noise. Have you ever been around someone with hearing aids, or do you know like the different styles or anything else?
Just my parents and my older sister have used hearing aids,
Right.
and they always had really big hearing aids, which, like, I'm not a fan of. If I had hearing loss and, like, I may be thinking about getting hearing aids, if I end up, coming out with a hearing loss today or whatever. But if I were to get them, I would want them to be something that, like, people can't see and, like, know that I'm wearing.
Okay. So something smaller, if possible.
Yeah, I really want to be able to communicate with my family and friends when we go out to eat.
Okay. And you're not really particular on the style, like either behind or like inside that you're like the custom ones?
Yeah, I'd have to see the options that are available because I don't really know what's on the market anymore.
Okay. Now what I'm gonna have you do is that I'm gonna have you look at this sheet and I'm gonna have you fill out any of the boxes that you feel like you're having trouble with to help you hear better.
Okay.
And you can just take a minute to do this on your own.
Okay. Let's see. Oh, this is tough. There's a lot of boxes. Let's see. I want to hear better at adult conversations. Ooh, small family gatherings for sure. Quiet restaurants, I don't know. Sometimes it's okay, sometimes it's not. Let's see. Oh my gosh, iPods, no. Small group meetings for sure with my ladies. Ooh, shopping, yes. Want to be able to hear there for sure. Group presentations. I can't remember the last time I went to a group presentation. Man, I must have been like 20 years old, coming out of college.
Just rate whatever situations you're in the like most often.
Okay.
For like, and that are the most important to you.
Okay. Oh, busy restaurants. Mm-hmm. Social gatherings, I'm really social. I have like a huge friend group. It's, yeah. Multimedia connectivity. That's a thing.
Yes. So there's a couple of different options if you're interested. Like if like let's say you have like family members that often complain that you have difficulty with with like you turn up the TV a lot. So what you can do is there's this like a TV box basically that can connect directly to your hearing aids, or you can connect your hearing aids directly to your phone. It kind of depends on what phone you have. So it's just
That's
like
cool.
yes.
I like my Wednesday night Wheel of Fortune, so might have to, if I get hearing aids, consider something like that. Okay, I think that is it.
Okay.
There you go.
See it? And then what are the top 3 environments that you would like to hear better?
Like, do you mean like loud, quiet?
That the top 3 environments you would like to hear better. Like let's say you're in an environment where you can hear but you don't understand.
Oh, so like at the restaurant.
Okay.
Restaurant for sure is one of them. Let's see. Church.
Okay.
And then like social gatherings with my ladies.
Okay.
I'm a social butterfly.
Okay.
That's what my mom used to call me.
So, that this is all information that's good to know because what we can do is we can get you set up with the hearing test. First up, before I do that, I can take a look in your ears and make sure that's working. Then I can go and I can use this machine. It's called a tympanometer, and I can also test how your eardrum and bones are moving and make sure that's working okay. And then after that, I can test your hearing and see about where your level is. So
Sounds good. Let's get some answers.
okay. Thank you so much for coming in today.
Yeah.
And let's go ahead and get started.
All right.